Good evening. I'm Dr. Valerie Donaldson, and welcome to the VIV webinar. I hope you all enjoy it. For those of you people who are on that don't know me, I own the Regenerative Medicine Center in Pittsburgh, Pennsylvania, and I have been working as a regenerative physician for about 20 years now. So I am going to turn me off, not my voice, but the picture off, I believe, right? So. And get on with the webinar here. I don't know if I'm going off or not. At any rate, I'm board certified in internal and emergency medicine. I did emergency medicine for the first half of my career, and I've been doing regenerative medicine for my second half of the career. I got certified in anti-aging medicine, functional medicine, bioidentical hormones, stem cells, PRP, and then most recently peptide therapy. What led me to the VIV was my hobbies growing up, which was riding cutting horses, which are the second hardest horses to ride after the bronc, running marathons, doing hot yoga and snow skiing extreme terrain. Through the trees are my favorite things to do. So lots of bouncing up and down. On top of that, I had 5 kids. So through the years, I started noticing that vaginally I was getting more and more lax, and it was time to do something about it. So I started researching different machines, actually, in companies, and would try them out personally myself. So I've had personal experience with several different companies' machines. And then I came upon the VIV. The VIV caught my eye, and I was very interested in it because they had a company whose only focus was vaginal restoration and women's health. All the other companies were doing this as an add-on to the company that they already had. So when I met with the owner of the company, I was very impressed because they actually were doing the FDA studies that was bringing this technology into being. So they're very, very advanced and concerned about women's safety and their vaginal health. The VIV treats stress incontinence, and one of the things that's happening right now that's very exciting is they're just finishing up their study of almost 400 women that they are going to present to the FDA to get FDA approval, hopefully, for stress incontinence using the VIV. So this would be awesome. Stress incontinence affects a lot of women. It affects at least 33% of the women in our country. And especially in women college athletes, they have a really hard time with stress incontinence, again, because they bounce up and down a lot like I did. So there are quite a few number of young women that actually need this treatment also, which surprised me truly when I first started researching stress incontinence. One of the things that happens is some women don't even know what stress incontinence is, and they have it. Okay, so they just think that when you laugh and cough and you sneeze or you work out, you're always supposed to have stress incontinence. It's interesting to me that they, think that's just a normal way of life, and they deal with it with panty liners as protection and go on about their day. Stress incontinence really affects your life, and it was when it started affecting my life that I really started looking for a solution. It starts restricting the activities you do. So the first activity it restricted with me was jumping on the trampoline with the kids. All of a sudden I thought, okay, I can't do this anymore. It also affected me when I was riding the horses. So then it starts limiting your choices in life, and that did not feel good to me. It restricts the feelings and can really lead to depression because people don't want to go out because they're embarrassed that they might leak or smell. Women don't want to have sex for the same reason. And because of all of the above, you stop going out as much, really. Traditional treatments weren't real optional treatments for me. Pelvic floor physical therapy, I really didn't have the time and the space to do that. Vaginal pessary inserts were not for me at all. You have invasive procedures with mesh. They're having a lot of problems with mesh now. So I kind of checked that off my list. And then the bladder sling is what they're really using right now, and only in extreme cases. So there's really nothing out there for women with mild to moderate stress incontinence. There were 6 things that convinced me that Viviv was going to be the treatment for me, and that I wanted to give it or have it be available for other women. The clinical studies were there to support its use, and I don't know of any other company that is doing any clinical trials on their product. It is pending FDA approval for stress urinary incontinence. That probably won't come into being for a couple of years, just so you know. It's a slow road. There's a CEO that is committed to women's quality of life, which I appreciated. And one of the biggest things was that it was a single 40-minute treatment. All the other modalities that I tried, you had to come back once a month for 3 months. So I like the idea that I didn't have to spend a whole lot of time to get a good result. The reason that it's only one treatment versus the other machines is because it uses 2 modalities in one. It uses the radiofrequency and cryotherapy together. Radiofrequency actually goes underneath the skin and burns, and the cryotherapy cools as it burns. So it's actually not a painful procedure. And then I tried it and it worked. So I was excited, and I got some of my staff members to try it, and it worked for them too. So we were all in. Viviv also does vaginal rejuvenation. Okay, so when it's doing the vaginal rejuvenation, it's actually treating your stress incontinence. Vaginal laxity is really quite common. It's the #1 reported post-delivery physical change for women. Nearly 1 out of 2 women feels that vaginal laxity is a concern post-birth. And there are women that come in post-birth to get the procedure done because of this. And they feel great afterwards, by the way. A majority of women do not discuss this issue at all. I mean, it's not something you meet your friends and over a cup of coffee, you're going to say, hey, how's your stress incontinence doing? It's just not something that is conversational, at least in the United States. And they don't discuss their vaginal laxity with each other usually either, mostly because they're embarrassed. Physicians are either too old, too young, or the wrong sex, and or they don't feel anybody will understand. How vaginal laxity affects you, you feel loose, okay, in your vaginal area. You have diminished sensation during sexual intercourse. You have a decrease in your sexual satisfaction or your orgasm. That's not going to be as strong or as satisfying for you. You have a reduced overall feeling of sexual well-being. You start having stress incontinence, and then you start having vaginal atrophy, and that's when women start getting a lot of urinary tract infections. Psychologically, there's negative impact on relationships, as you can imagine. There's a reduction in desire for sex because you're not stimulated anymore, so why would you want it? There's a lower inner confidence and self-sexuality confidence. There's a change in your whole body image because all of a sudden you don't feel flirty anymore. And it kind of worsens the quality of your life. So it really does affect a person as a whole. The Viviv reason to believe. Masters and Johnson's established that friction is really, really important and it happens in the outer 1/3 of the vagina. So that's where the treatment is targeted. And this is what we want to have become more sensitive. These were just questionnaires this is part of the study that they're doing right now, and the questionnaires that they were giving out. So I just included them so you can see what women were filling out. So they started, 1 to 7. 1 is very loose and 7 is very tight. And then anything in between. The sexual function index was, what is your sexual desire or interest? What's your sexual arousal, lubrication, orgasm, your satisfaction, and do you have any pain? Women have pain, certainly when they're not lubricated enough. The VAVIV, this is a preliminary, the first set clinical trial actually that they did. It showed significant improvement in sexual function, and 93% of the women said that they had a positive change in arousal or orgasm. I can tell you in my clinic to date, knock on wood, we've had 100% that have said that they have increased arousal and orgasm. And we're proud of that, believe me. The side effects, okay, everybody wants to know what side effects are. This is the best part because side effects of VAVIV are awesome. We all want the side effects, okay? So the side effects are increased vaginal lubrication. So when you do this treatment, the next day you will have increased vaginal lubrication. It's like magic. You'll also have increase in your orgasm strength. You'll have increase in your libido. You'll have increased strength in your vaginal wall. You'll be able to bear down or do Kegels more easily and with a stronger contraction. You'll have decreased urinary tract infections because you're rejuvenating the vaginal area. And it works on all women, whether they're on hormone replacement or not. I think that's one of the best things about this treatment. So as your desire increases, so does intimacy with your partner. And that's really the goal here, is to get everybody kind of back together in bed with each other. When we do the VAVIV, I always include what we call the WOW shot, which is a PRP shot into the vagina. I included this because I think it's amazing, and I think that no one should be without it. So it is included in your price, and you get that automatically unless you tell us you do not want it. But I would never turn it down, personally. The other thing that we're going to include here is a handheld device called the Elfie for whoever signs up tonight, just so you know, and I'll talk about that a little bit more in a minute. So vaginal rejuvenation, when your vagina becomes rejuvenated, you have more sex, more orgasms, you feel more alive, you have vitality, and you have intimacy again. How the VAVIV works is it increases collagen in the vaginal tissue, and it does this by the radio frequencies going into the membrane of the vagina. And this is before treatment where things are kind of pulled apart a little bit, and this is after treatment where you can see that they're pushed together a little bit and have a lot more blood flow. What should I expect during my treatment day? We don't use any medications or anesthesia. There's a small medical device that's placed on the vaginal opening and inside the vagina for several seconds, and then it's moved to another spot. If you have scar tissue in your vagina, it may hurt. I'm just throwing that out there. If it does, what we do is we just put a little lidocaine, a topical lidocaine jelly there, and it takes care of it. The heat is what causes collagen restoration and production. Patients report feeling sensations of cool or warmth or both, because that's what they're getting, quite honestly. Most patients find the treatment comfortable. I have to say, I think we have the best nurse in the country to do this procedure. Everybody absolutely loves her and says so as they leave. They say, you know, it's amazing that you can have this treatment being done and have a great time at the same time. Scar tissue, yeah, it can be sensitive. I talked about that. Takes about 40 minutes. And they say one treatment needed was sustained results for 1 to 2 years. That's variable on the amount of stress incontinence you have, but we will not retreat anyone for at least 4 to 6 months, and usually 6 months, because it can take that long for the entire treatment to actually materialize. So most people go over a year now, and they come back in just because they want it, not because they think they need it again. They like the side effects. Am I a good candidate for Viveve? Yeah, if you have any urinary incontinence, if you have air passing from your vagina, certainly during any of your exercise classes, if you have any vaginal dryness, vaginal laxity, where you know that the tissues are just kind of sagging now, if you have poor orgasms or decreased libido, certainly the Viveve is for you, and I certainly would check it out. The Viveve can be done at any age, really. The warnings and precautions really are if you're pregnant or breastfeeding, or if you're receiving chemotherapy from cancer, or if you have any large medical implant or any chronic infectious disease, or you're allergic to any of the components of the Viveve tip, which no one actually has had any kind of allergic reactions. What to expect is a comfortable, fun time, actually, for about 45 minutes in the office. During the Viveve treatment, your vagina is cooled again and heated to create the collagen formation. Your body responds to the treatment by generating new and restored existing collagen. So there is a huge, much more collagen that's being generated. And typically women will tell us with the PRP shot, they'll tell us they feel a difference in 24 hours. As far as stress incontinence goes, some women feel it immediately, and some women feel it later on. Same thing with libido. I had one lady who went about 2 months before she noticed an increased libido, and it was pretty cute, because when she did, she said, you know what, it's been so long, I don't know what to do anymore. So that was pretty cute, but she got in the hang of it right away again. Typically, it takes about 30 days for most people, and the full effect at least 90 days. And I think it's even goes out to more like 4 months that people can still have continued results. And then sustained results are documented at 12 months. So the research that they're doing right now, and the clinical trial that they're doing right now, they're doing at a 12-month interval. So they're doing one treatment and then assessing people at 3 and 6 and 12 months to see how they are doing. What patients are saying is all good. And it's really fun to be a part of that. So one 63-year-old with 2 children said, I thought I had my stress incontinence under control and Viveve would not make that much difference, but boy, was I wrong. It's the best thing I've done. The outcome was way beyond my expectations. And then my husband used to chase me around the house for sex. Now I'm chasing him. I love it. Thank you, Viveve. And the 42-year-old said, thank you for saving my marriage. She had a lot of vaginal dryness after birth. And so this was a magic bullet for her. And then a 28-year-old that got the WOW treatment said it was painless And by the next day, I felt myself tighter inside. Now I feel confident and back to my old self. So why Viviv is overtopped amazing is that the system is designed to treat women who are experiencing urinary incontinence and sexual dysfunction and vaginal laxity. That's a lot to treat in one treatment in 40 minutes. I think it's awesome. And it's all in just one session too. So I hope you all will try it. The product that I was talking about earlier is a product called LV. You can look it up on the internet. We're going to be giving away an LV to everybody who signs up for the webinar tonight or tomorrow. And it is if you can't see me, it is just a little handheld device that you use and can track down on. And there's an app on your phone that you set up with it. And it will tell you how strong your contractions are in your vagina. It takes 5 minutes a day to do. And it's kind of your exercise routine after you've had the Viviv done to increase your vaginal strength. It's very easy to use, very discreet, and I like it a lot too. So benefits are priceless from the Viviv. And until you have the Viviv, I don't think you can even understand how much better you feel. So you feel a lot more freedom. You feel a lot more confidence. You feel intimacy again. You're alive again, and you have vitality again. And I think everybody wants that in their lives. So thank you for your attention. I'm going to take questions on the chat box if I can figure it out.
Just to interrupt you, Dr. Donaldson, the LV is for anybody that signs up for a treatment, correct?
Yeah.
Okay.
Yeah. The LV is for anybody who signs up for the treatment tonight. Sorry.
Or tomorrow.
Yeah, tomorrow. Here we go. Why is there a time frame? Because everybody wants to know how long it's going to last. And that's important to know. I can tell you that I have had women that have never been on hormone replacement therapy. These are actually breast cancer patients that have never been on hormone replacement therapy, went through chemotherapy, et cetera, have no hormones, got one treatment and are 2 years out now. So it will last as long as you take care of your vagina, really. Personally, I like to do it once a year. I would probably do it more than that if I had time to, because I get a lot of benefits from it. Yeah. Did I answer your question? All right. Any other questions? All right. Well, hopefully we will talk to you and see you soon. Have a great night. Now we got to figure out how to turn it off. Over here.